There are many, many ways that we can support people with dementia, and we need to think about what's going on in their immediate environment. And that environment has to be enabling. Too often the environment is disabling. It stops people doing things they could have done, or it makes life worse for them. So that environment has to be calm, it has to be predictable, and it has to make sense to someone who's got dementia. Noise is one of the most distressing things for people with dementia. And if you think about an ordinary house, there's a whole lot of things going on that we think are quite normal and natural. You think about the television. The television can be very disturbing to people with dementia. The clatter of cutlery, clatter of crockery, people talking on the phone. It's one of the reasons we get a lot of challenging behaviour at mealtimes with people who have dementia, because of the noise level. Staff need to talk more quietly, they need to think about what they're doing. We also need to think about things like turning the television off, and that's very hard. So maybe we should think about things like headphones for people to put on so that they can listen to the television.
That's not a problem. That's not a problem.
There's always been a need for staff to adapt the way that they talk or work with someone who has a learning difficulty. When dementia is also added to the picture, well, this changes completely the way that staff need to communicate. They need to unlearn the methods of communication that they've used in the past and start again.
You're right.
We know that people with a learning difficulty and dementia are not getting adequate pain relief because staff are not able to understand when or where the pain is. And very often what happens is they seem to have challenging behaviour. If we think about Derek holding his stomach, it may well mean that he has tummy ache. It might mean actually that he has a pain somewhere else, but he's holding his tummy because he can't locate actually where the pain is.
Derek, lunch is ready.
When Derek gets called to go to the meal for his lunch, it's possible that Derek had no idea what was happening at all. So alongside the fact that he hasn't had any cues to the routine or what's happening, it may be that he also didn't understand the words or what was expected of him.
Lunch is ready, come on.
Just be careful when you're thinking about placing food around for people to pick up, that it looks like food and there aren't other distracting items around. And some of the classics are potpourri and other ornaments that would distract somebody and would look like food.
Because the food wasn't already on the table, he wouldn't have seen it, he wouldn't have smelt it, so all the cues that are needed for him to actually realise that it's mealtime would not have been there.
That's a good lad. Derek, where are you going?
One of the problems for people with dementia is very early on in the condition, they lose their ability to see things in 3D. So they will see changes in pattern, so a very complicated pattern carpet like the one we saw that Derek had in his sitting room would cause people a tremendous problem. They would try and step over things when they moved from one room to another, where you get a change in colour and texture of carpet. You'll also see people having a problem with bathrooms, because again the flooring there is very shiny, and to a person with dementia that looks like a pool of water, and you'll see people refusing to stand on that, to go into the bathroom, go into the kitchen, or you'll see them walking along the wall with their back pressed against a wall, trying not to get their feet wet in the water. There is non-slip vinyl that isn't shiny. Try and make that the same colour. So if you've got green carpet on the landing or the hall, try and make the vinyl green as well.
Derek, where are you going?
I don't see my mum.
Two words that people with dementia use more than any other are mother and home. And I think that tells us a lot of what we need to know if we want to understand the world of people with dementia.
It's a bit cold outside.
No, I'm going to see Mum.
No, you live here now.
No, you're a liar.
The message they're giving to us then is that I don't feel safe, I don't feel at home. And that's because of their loss of short-term memory, because of their loss of their knowledge about where they are and who you are, they feel alone.
Come on, I've got your lunch ready.
Liar!
No, Derek, come on, your lunch is ready.
But very often, for example, reminding someone that their mother is dead is actually quite abusive. It's cruel. Absolutely should not be done. They are going to grieve as if that is the first time they've ever heard that. So what we would do is we would go along with their reality. So we might say something like, for example, if somebody's wanting to go home, very often what I would say is, hang on a minute, I'll get my coat, I'll walk down the road with you. They've got dementia. They're going to forget the thing that agitated them, that made them want to go home. You don't have to go very far before you can say, I wonder if the kettle's boiled yet or something, and return. But you stick with their reality, and all the staff have to do the same. You cannot have one member of staff doing one thing and one member of staff doing the other.
In you come. That's you, right? When you sit down here. Fantastic.
As dementia progresses, what we see first are kind of perceptual problems and sensory problems at mealtimes. So maybe people forgetting about the routine of mealtimes, or not recognising utensils on the plate, or not recognising food on the plate, not understanding what drinks are.
A small pattern will often look like maybe a piece of rubbish or something that needs to be picked up. So whereas in the carpet people might try and step over a big pattern, with a small pattern they'll try and pick the pattern up.
The plate is very patterned, so the food doesn't stand out on the plate. So he's watching for somebody else to model to him what he needs to do. So when his friend starts to eat from the plate, then he gets a clue, which then means he takes food off the plate, because that's the only clue he's been given.
What are you doing? No!
We sometimes say that visual perception is affected, and people, for example, might only actually see one side of a plate, so they will eat entirely from one side of a plate and ignore the other half of the plate. It's what we would call visual agnosia. It's very simple if staff just turn the plate round so they can finish the second half of the plate.
Good practice would be having things on the table that have good contrast and are simple. So having maybe a white tablecloth, red mats, blue plates, that enables the person to see the differences, not having any patterns on anything.
As dementia progresses, it starts to damage the nerve pathways and the muscles which control eating and drinking and swallowing, so we start to see actual physical problems with people's ability to eat. So people don't necessarily know where the food is in their mouth, they forget to chew, they appear to forget to swallow. There's lots of people who can help. Speech and language therapists would look at the eating and drinking and assess that. But also occupational therapists can help, physiotherapists can help, but just mention it to somebody in the community team or their GP and ask for further help.
What are you doing down there, Derek? Come on, Derek, come on, up you come.
Most challenging behaviour amongst people with dementia is induced by the environment, by the social, the emotional and the physical environment. It's not the dementia.
Come on, right, that's it, darling, come on.
Some people with learning difficulties grow up in large institutions, so their sense of reality, if they have dementia, will be very different. They may be used to very set routines. For example, if someone always cleared away the table after a mealtime, if they have dementia, they may go back to this particular time and become quite upset if anyone else tries to clear the table for them.
Aye.
No, because you're in a state and you're getting yourself all upset.
Aye.
Right, just round this corner. Come on, that's it.
If the staff can get the right response, we know they can dramatically reduce challenging behaviour. And that is better for everybody. It means we can reduce the amount of drugs people are taking. A high proportion of drugs that people with a learning difficulty and dementia have are there because they have challenging behaviour.
Derek, you missed your room. Come on, this is it here.
One of the characteristics of the condition is that people are losing their short-term memory. They're slowly moving backwards in their lives. That means that if they're in an environment which is very modern, an environment which doesn't have lots of signs and clues, they are going to feel lost and agitated and frightened.
No!
Right?
Get him out here!
No, come on, you're seeing things, no again.
So that what we need to do is to have lots of things which help the person understand where they are, what they're meant to be doing and where they're going. So putting signs on doors, for example, is one way we can do that. So pictures of them when they were younger, putting things outside the door that will draw them to that door. Where the signs go is so important. I have the experience often of people putting signs up and then saying they don't work. And that's because we'll often put the signs up at our eye level. But if you think of someone with Down syndrome, they're much shorter than us, and they will often walk past the sign.
When someone with dementia looks in a mirror, they may very well not recognise themselves for who they are. But they may look and see an older person because in their own sense of reality, they're much younger.
I'm Derek.
So they may see themselves as a family member, or they may completely not recognise the person at all.
People can be terrified by mirrors, by what they see in the mirror.
What is it, Derek? What do you see?
My dad.
It's only you, Derek.
A very common experience that I come across is people at night shouting, "There's a man in my room, get that man out my room." Or a lady that I know who said people were dancing on the end of her bed. And if you say people are dancing on the end of your bed, it's a short step to getting some antipsychotic medication. That sounds pretty hallucinatory. But actually when I went in the bedroom, there was the dressing table with the 3 mirrors on. And of course, the more she was shouting at this mirror, "Get out my room," the more people were dancing at the end of her bed. So what we need to do is to think about the mirrors. So it may be that a mirror is fine in the morning, but not at night. Or when he walked past the door and he saw his reflection in the glass and he saw somebody outside. That couldn't be Derek, that was another person because they were too old to be Derek as he perceived himself.
For people with dementia, it's particularly important that we know about their life in the past so that we can communicate with them in the present and the future. And life story work is the way that we can do this.
Derek, look what I found. Who's that?
It's me.
Is that you?
Aye.
All right.
In Derek's photo album, for example, there's not just the photographs, because in time he may actually forget who those photographs are of. So what's essential is that there's notes and information written for future carers so they can talk to him about the photographs. Without that information, the photographs won't mean anything.
One of the things about having Down syndrome is you have quite short legs. The problem is when you've got dementia, the part of your brain that understands the geography of your body has gone, and the person no longer can organise their body in the way they did before. So what we very often see is people with Down syndrome in chairs they've always sat in, but sitting with their legs dangling, and then slowly they slip down the chair. And what then happens is they end up with a backache. And become very, very distressed. So we need to think about the sort of seating that people have. We need to support people, support their feet. People with dementia need supporting.
It can be very distressing for someone with a learning difficulty when a friend has dementia. These friends can actually offer a very supportive role if they know what's happening to them. Staff are generally not very good at explaining dementia to the friends of someone who has a learning difficulty. And this is usually out of a misplaced sense of trying to protect them or feeling that they shouldn't have that kind of information.
Found out I had dementia. None as no.
It wasn't explained to him what was happening to his friend, so he wasn't involved in being able to help at all. It was more confusing and more worrying for him, actually not knowing what was happening to her.
The staff should told us properly, not push it aside. The staff should be taught better. Staff don't listen. One do miss her. One still do.
It's really important to explain to someone with a learning difficulty when their friend or relative has dementia so that they can be involved in future care and contact and preparation for the future. It can be quite devastating for Michael, for example, who wasn't kept up to date and wasn't informed as to what was happening with his dad's illness.
To me, the staff in the first nursing home were very cool. In fact, they were very cold. They didn't seem to want to tell me anything. No matter how I tried to ask them, They just didn't want to tell me for whatever reason. And I felt like really losing my cool with them, because I was thinking to myself, look, this is me. I want to know how my dad is, what he's got, things like that. And they wouldn't tell me. We kept thinking it could have been anything. But unfortunately, we never thought about dementia. In fact, neither Sylv nor I knew about dementia. So I must admit I'm a bit embarrassed about that.
Not to give information about these changes to someone with a learning difficulty can be extremely traumatic and distressing. It can sometimes be harder actually not to know and to imagine things that might be happening than actually to be told the truth.
Who's that there? Can you see it? Who's that? That's your dad, isn't it?
Aye.
There's many, many ways that we can support people with dementia. And most of those ways are actually quite cheap. They're quite straightforward and they're not complicated.